Hello, everyone. My name is Taylor Lazowski. I'm going to be presenting stress, burnout, and self care, what you need to know as a nurse. So, the issue is nurses are experiencing overwhelming stress and burnout due to work related activities, and there needs to be a change. I work in a surgical trauma ICU, and I can probably name about 20 stressors that I dealt with just yesterday at work, as I'm sure a lot of you work in different disciplines and could also name many stressors that you deal with in your unit. So, the stress that occurs at work can move on to the personal life of the nurse, affecting their emotions and their mental state. It can impair the care that they provide and it can cause negative patient outcomes. And it can also impact the financial state of the facility as nurses that are experiencing burnout and a lot of stress may tend to leave a work environment and it can decrease nurse retention, which negatively impacts the financial state of the facility. So, stress is an individual's reaction to change that demands a response or adjustment. The body typically reacts to the change with emotional, physical, and mental responses. Personally, I may have a combination of the three of these responses when I'm dealing with a stressful time or environment. Emotionally, I may become angry or I may cry. Physically, I may feel fatigued and just feel like I can no longer perform a task. And mentally, I may have anxiety or just keep thinking about the situation. A stressful experience can be caused by the body, an individual's thoughts, or from the environment. Has anyone been in the unit one day or wherever you may work and there have been multiple codes or rapid responses? Feels like it's just a constant influx of patient admissions. You have the call lights going off. You have family members at the nurse's station, the phone keeps ringing, and you just stop and you sit there for a minute and you say, wow, this is a very stressful day, and I'm in a very stressful work environment. And sometimes it feels like you don't even know what to do. So, this is just a little, I guess you want to say, a chart that I created. I actually had a nurse come up to me a couple weeks ago and just out of nowhere said, we have a very stressful job. This is an extremely stressful environment. We're with these patients on some of the worst days of their lives, which, puts another load of stress on us. What can we do about this? Because we need to do something. And I was almost shocked because I had been working on this self care project and paper. So him and I kind of collaborated just on this little chart, and we had the nurse in the middle. So there's 6 components here. I'm sure we could name at least 10 more, but just starting with patients. So when patients are in the hospital, they're probably having a very bad day. They're either very sick or, they're requiring this care, they're losing their independence, and you may have one, two, three, maybe even up to 6 or 7 patients that all need your care, they all need your attention, and it can cause a very large strain on you emotionally and physically. We have documentation. If you didn't document it, you didn't do it. It seems like almost every day I get an email from my managers saying, we're going to be having another task in our admission assessment that's going to involve some type of documentation. You may have had a stressful day. There may have been a code and a patient may have expired, and you're trying to write your note and gather all your thoughts. And when you get home, you say, oh man, I forgot to document my skin assessment, or I forgot to put the doctor's name in my note, and I hope that everything's okay. I'm going to get an email from my manager that I forgot to do my restraint documentation, so that can be very stressful. You have your unexpected events. Sometimes patients code, they may have a rapid response. You may have to take them down for a test you weren't expecting to go to, and it can mess up the flow of your day and cause unnecessary stress. We have families. There are great families, there are not so great families, but regardless, we have to care for them as well as the patient. They may be calling you every hour trying to get an update. They may constantly be at the nurse's station or criticizing the care you're providing, and that can cause stress. And lastly, we have interdisciplinary care. I feel that I work day shift. Within the first hour of the shift, I have endocrinology, oncology, transplant services, surgical services, all asking me how the patient's night went. And then you have physical therapy coming up to trying to collaborate a time that you can work together to get the patient out of bed. You have pharmacy calling you, asking you if you have the patient's med in your drawer, if they need to bring you another med. And altogether, these 6 components can make up your day and cause so much stress. And that leads us to self care, taking action to care for the mind, body, and spirit, choices that improve physical, emotional, and mental health. So here I have 6 different self-care activities. Obviously, you can't take a warm bath and sleep at work unless you work in California and they have those great nap times for night shift. But they are 2 great activities you could do when you get home for a self care activity. Some things you can do at work are go for a walk. We have a little shortcut from door to cafeteria where it's about a 2-minute walk outside. Sometimes just that fresh air and that sunshine you feel on your body can really help with your emotions. You can take a breath, something as simple as that. You could go in the break room, you could go in the bathroom, you can go in an empty patient room, just sit there for 1 minute and take some breaths. That can really help. And then I actually found out from my managers trying to inquire more information about what self care activities we have. And we actually have a meditation room that I didn't know about. So, doing yoga could be something I could perform. And hopefully, at your facility, you also may have some kind of room or center that you're allowed to go to when you're feeling stressed. So, applicability to nursing practice. There's undergraduate and graduate stressors. So, I feel like I did touch on the undergraduate. You may work in a medical surgical unit, emergency department, surgical services, operating room. There are so many different things that are going to cause stress, and you need to have self care to be able to properly care for your emotions, care for yourself, to be able to care for others. And then there's graduate. I'm sure most of us are probably going to be either nurse practitioners or clinical nurse educators. And with that, we're going to be having a big transition from undergraduate to graduate responsibilities. And to be an effective leader in healthcare, we need to have these self care interventions in place. So, my anticipated career trajectory is adult gerontology, acute care nurse practitioner, hopefully in an ICU setting. So, what is the effect of self care for me? First is for interaction and communication with nurses and disciplines. Because there's going to be these new role duties of increased patient loads, care duties, new experiences, such as intubating patients in emergency situations, placing central lines, and also holding family meetings, I need to be able to manage my stress so I can be clear minded, level headed, have my anxieties and stress at a manageable level, to be able to perform and be a leader and bring the best care provider to the forefront, because I want my patients to have the best care provider that they can have for excellent patient outcomes. Just some small, going into more detail, family meetings, you go from undergraduate kind of being in the background to a family meeting, and then being the one that's responsible for explaining that the patient may be suffering, they may need to be on comfort care, and dealing with death. Those kind of conversations can be very stressful, so having self-care in place can be very effective in being able to conduct these meetings and be efficient and effective with the family. So, some important findings, I am going to post this to the discussion board so you can read all these in a little bit more depth, but I just wanted to read 2. Burnout and compassion fatigue are one of the most significant issues occurring in nursing practice today. And the last one is that the relationship between emotional exhaustion and turnover rates due to burnout syndrome costs facilities about $300,000 annually for each percentage increase of nurse turnover. So this kind of relates to a previous slide, how I said the cost of nurse burnout really can affect a healthcare facility. Next, we're moving on to literature review. I found 8 or 9 journal articles for my paper, but I just found the 5 best for this presentation. So the first one is about patient outcomes. This was a cross-sectional study that evaluated questionnaires performed by 1,524 nurses to determine how the following impacted patient outcomes. So first, improved work environments are directly correlated with decreased nurse burnout and decreased adverse effects. Second, decreased amounts of undone care is correlated with decreased nurse burnout. What stuck out to me about this one is, have you ever been on your 12-hour shift? It's 5 o'clock, you have 2 more hours to go, and you realize you still have to draw labs on patient A, patient B still needs a bath, patient C still needs help back to bed and they're a 2-person assist, another nurse just asked you to help transfer their patient, and another nurse needs help with a turn, and you're thinking, how am I going to get everything done in the next 2 hours? Next, decreased workload is correlated with increased nurse satisfaction. I feel like this has a lot to do with staffing ratios. Having a good staffing ratio can decrease your workload. And lastly, direct negative correlation between nurse burnout and nurse-reported patient safety reports. This was very important to me, as it's showing that nurse burnout and stress stress, can definitely impact our patient safety outcomes. Next was an online-based self-assessment by Bursch et al. There were over 119 nurse participants that filled out an online self-assessment, and they received immediate feedback about anxiety, stress symptoms, and mindfulness awareness. 79% deemed the assessment useful, which I thought was a very great number, and I would love to have an online-based self-assessment for myself as well as my coworkers so we could identify how many of us are feeling stressed and having anxiety, and then trying to determine and work with management to see what we could do to decrease the stress and anxiety in our unit. Next is about Reiki therapy. This was a mixed method study with 24 participants that were educated on Reiki therapy benefits and how to perform the exercises. 54% of participants had positive changes with common themes of calmness, healthier lifestyles, and care for themselves. So Reiki therapy is something that you could perform at work, if you have a meditation room, or maybe you could go in your break room and just perform this for 5 minutes, or it could be something you do at home. It could be part of your after work ritual to perform this for 10 or 15 minutes when you get home. Next is meditation, which is also a mixed method study by Dies et al. There were 22 nurse participants. They filled out questionnaires evaluating locus of control, mindfulness, and self-esteem. There was a significant reduction in stress from 16.86 in the pre-implementation to 12.27 in the post-implementation period. And pre-test themes of being overwhelmed changed to post-test themes of understanding stress through management of self-care and intention. So meditation, again, is another intervention that you could perform at work, just stepping aside for 5 or 10 minutes, or again, doing this at home. Lastly, mindfulness-based stress reduction activities, which could range from mindfulness meditation, exercise, breathing, and yoga. So this was a literature review, and there were 3 main themes: that the mindfulness-based stress reduction interventions are correlated with higher nurse satisfaction and patient safety, that the MBSR needs to be performed routinely to be effective, and a common barrier is in completing the MBSR activities is lack of availability in facilities. So the stress reduction self-care activities cannot just be performed once a month. We need to stay up with this, whether it's performing it every day, performing it after every shift, and also working with management to make sure that we have these self-care activities in our units and available to us. So for future research, some of the sample sizes were small in some of the studies that I found, so I'd like to have more research with larger sample sizes to correlate with the large nursing workforce. Maybe investigating yoga, walking, music therapy, how talking or online groups, religion, journaling, meditation, and also the negative self-care activities, how maybe nurses may unfortunately go to smoking, tobacco use, alcohol use, and how the negative self-care activities impact nurses and what the rates are. And then any others. If anybody has any self-care activities that they do or would like to do, please post them to the discussion board. So the conceptual framework I used was the theory of planned behavior, which uses the 6 components of attitudes, behavioral intention, subjective norms, social norms, perceived power, and perceived behavioral control to help interpret how a person is going to behave. So before having the self-care intervention education, I would predict a person would behave with withdrawal, exhaustion, being absent, forgetful, and possibly drinking or going to substance abuse when feeling stressed, and changing that over to exercise, doing yoga, doing Jinshin Jitsu, meditation, journaling, centering, and being attentive after they've received self-care intervention education. So it's very important to take care of yourself so you can properly take care of others. I want to thank everybody for listening. Please post any questions to the discussion board, and I would love to know if you have any self-care interventions that you perform or would like to further investigate. I have found some other articles, so maybe I can relay the information if anybody has any questions about those. So again, thank you very much. And here are my references.